Hey everybody, this is Dr. Nick with the Springfield Wellness Center. Today I'm going to be talking to you about carpal tunnel syndrome, what it is, how do you know if you have it, and then also what do we do in our office. And we have a few different treatments that we'll talk about today. So first, what is carpal tunnel syndrome? So everyone knows that it's obviously in your wrist and that it causes pain or numbness down into your hand. So basically how it works is the median nerve, which is a compilation of the nerves that are at the base of your spine, so it's C5, 6, 7, 8, and then T1, the very top thoracic nerve. Those all come out of your spine and they form one nerve called the median nerve. That nerve runs down through your shoulder, down into your elbow, and then down through your wrist, and it actually innervates your thumb, your pointer finger, your middle finger, and then the inside of your ring finger. So if you have carpal tunnel, that's how we know if you have it or not, if you're getting numbness down into those parts of the hand. So the problem is that when people come in with it, they're thinking that, oh, well, it has to be carpal tunnel. Well, it can be actually pinched anywhere along the route of that nerve. So yeah, if it's being pinched in your wrist, then we want to address that, and that would be considered carpal tunnel syndrome. If it's coming from, say, your neck or your shoulder or your elbow, that's something that we have to consider as well. And there's also a syndrome called double crush syndrome where, yes, you may be having some irritation at your wrist, but you might also be having some irritation at your shoulder or your neck also. So each one of those by themselves may not be enough to cause any symptoms, but together those create the symptoms at the end of the nerve, which is your hand. So there's a couple of things that we do in the office to make sure that we're addressing the carpal tunnel if that's what it is. We would do an exam to determine if that's where it's coming from, and then the reason why the median nerve gets pressed in the tunnel is because it's a small space, so there's a lot of things that can create a lack of space within that tunnel. So the tunnel is basically just the space the median nerve and then the finger flexors, the tendons run through. So there are bones that make up your wrist. So there's 8 small bones that are in 2 rows of 4. And then there's a tendon that runs over the top of the carpal tunnel. So if those bones are pushing into the tunnel, or if that ligament gets tight, or if there's any kind of inflammation in there, that's going to create pressure on the nerve, and then when the nerve gets pressed, that's when you feel the symptoms. So the things that we look at are how are the muscles, ligaments, and joints doing, and then how can we address any kind of inflammation. So we'll talk a little bit more about those treatments now.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.